Hi, this is Dr. Peter Grinspoon. Thanks for listening to my YouTube channel. Today we're talking about pressed pills and contaminated cocaine, the dangerous contamination that's affecting millions of Americans who use illicit drugs. Before we get started, please press the button on the bottom right of your screen and for free, subscribe to my YouTube channel. We have a lot of great content. Millions of Americans, it's no secret, use illegal drugs. And the problem is the supply is getting much, much more dangerous. The rates of illegal drug use have been about stable, but the rates of fatal and non-fatal overdoses are climbing astronomically. I am personally about 20 years into recovery from an opiate addiction. Back in the day, when I took a 30 milligram oxycodone, I knew what the effects were going to be. It was very, very difficult to have a blackout or to overdose because 30 milligrams of oxycodone was 30 milligrams of oxycodone. I'm not advocating doing this. It was a complete disaster to be addicted, but it wasn't life-threatening. These days, the pills are contaminated with fentanyl and with many other substances, as we're going to discuss. It isn't just the oxycodone. People buy Klonopin, Xanax, Adderall, Percocet, and other drugs on the streets, thinking that they're getting the drug that they're buying, but they're actually getting fentanyl, and the overdoses are going up dramatically. How do we get all these contaminated pills, these pills that look like normal pills, but are contaminated with fentanyl? The drug dealers and the drug distributors came upon a brilliant idea. Remember, this is all about money, and fentanyl isn't that difficult to procure, and it isn't that expensive. And people found out that if you buy powder, you just get talc or sucralose or some inert agent and sprinkle a bunch of fentanyl into it, and then you could press it to look like a Xanax, or you could press it to look like a Klonopin, or press it to look like an oxycodone, and voila, there are pills that are being sold that are indistinguishable on the street. The only difference is people take them and they overdose on the fentanyl. It's estimated that up to 70% of these pills that people are buying on the street contain potentially lethal doses of fentanyl. Now, this is a huge disaster. These pills are everywhere. We see it all the time, people taking these pills and overdosing at the addiction clinic at the hospital where I work. And the government recently estimated that last year, 115 million pills were confiscated. So the pills are everywhere, people are overdosing left and right, and the entire drug supply is contaminated. Now, it's not just contaminated with fentanyl, which is bad enough. For example, a lot of these pills have xylazine in them, very common. In the street, it's called tranq. Xylazine is a veterinary tranquilizer that is in a huge percentage of the illegal pills and the regular fentanyl supply that people are consuming, and it's really dangerous. It causes much more sedation because it's a tranquilizer than just the fentanyl does. It makes overdoses much harder to reverse, and it also causes these nasty, nasty ulcers on the legs, on the arms and the legs, far away from where you inject it or sniff it. I know patients who have spent months in the hospital getting transplants and skin grafts for these nasty, nasty ulcers. And this is, again, all because the pill supply is incredibly contaminated and dangerous. And it's not just fentanyl and xylazine. There are a lot of other contaminants that I won't go through today that are contaminating the pill supply. Scientists buy pills on the streets and look at them in the lab, and it's really, really terrifying what's in these pills. Furthermore, the cocaine supply is also contaminated. It used to be the day, I'm not advocating this, cocaine could be a dangerous drug. It can cause addiction, psychosis, stroke, heart attack, high blood pressure, anxiety, paranoia. Any drug has its dangers. Of course, the dangers are much worse if it's illegal and the supply is contaminated and you don't really know what dose or what other substances you're getting. But it used to be, back in the day, you did a line of cocaine and some cocaine was stronger, some cocaine was weaker, but you basically knew what was going to happen. Not so these days. A huge amount of the supply of cocaine is contaminated with fentanyl. You read news stories about this all the time. College students do a line of cocaine and they end up dead or in the emergency room. These are increasingly common news stories. And I'm not saying this just to scare people. I'm saying this because it's a huge public health crisis. Now, there's a doctor I know who recently did a line of cocaine after a very long shift in the emergency room, and she woke up 12 hours later in the emergency room. She had a fentanyl overdose and she almost died. Now, we can certainly argue about the appropriateness of a doctor doing a lot of cocaine after being in the hospital. We could also argue, on the other hand, about like, shouldn't people be allowed to change their consciousness if they're not hurting anybody and they're not shirking responsibilities. But either way, this is crazy that she did a line of cocaine and almost died from a fentanyl overdose. This is again because the cocaine supply is heavily contaminated with fentanyl. Now, the rates of cocaine use in the United States have been very stable. A couple million people a year have past year cocaine use. The rates of past year cocaine use in the United States are about 1.4 to 2%. So if you know 50 people, one of them is using cocaine recreationally. So the rates of cocaine have stayed about stable, but the rates of overdoses, of hospitalizations, of like brain damage and of death are rising exponentially because of this increasingly dangerous and contaminated supply of cocaine. So it's not just the pills you buy in the street, the pressed Klonopin, Adderall, Xanax, or oxycodone. It's also the cocaine supply, which is dangerously contaminated. And as we'll discuss, this is all a result of inadequate treatment of addiction and of the way we criminalize all drug use so that everything has to be done in an unregulated, illegal black market, or illicit market, I should say. Now, the only drug that's not contaminated that gets a lot of press about this is cannabis. Every so often, a police department will come out with a press release saying, we arrested a drug dealer who was selling cannabis contaminated with fentanyl, and then it's a big, scary news story. And then universally, these stories get retracted because there is no fentanyl in cannabis. It doesn't make any sense. This is just part of law enforcement's ongoing propaganda campaign against cannabis, which we're seeing a lot more of, unfortunately, recently. The fact is that it's in nobody's interest to put fentanyl in cannabis. The cannabis users don't want it. This isn't what the cannabis users are looking for. It's a waste of money for the fentanyl dealers. They wouldn't waste their fentanyl on cannabis users. And you don't really smoke fentanyl because it boils off. That's why most people inject it or snort it. So it just isn't in anybody's interest to put fentanyl in cannabis. So despite all these scary news stories you hear about, they try to attach cannabis to this true and real narrative about the drug supply being contaminated with fentanyl, but it just doesn't apply to cannabis. Now, why would people who are addicted knowingly take pills or snort cocaine that are potentially contaminated with lethal doses of fentanyl and all this other crap we see in the drugs and in the cocaine? Well, this is one of the basic fundamental hallmarks of addiction: continued use despite negative consequences and loss of control. Again, when I was addicted, I would do the most irrational and dangerous things to obtain and use opiates because I would feel so sick when I was withdrawing. I'd have fever, muscle aches, nausea, vomiting, diarrhea. I'd be freezing. I'd be anxious. It was just awful. And you do almost anything to alleviate that kind of suffering. So people, for example, who are addicted to opiates, that's why they use contaminated needles that other people have used, even though in the back of their minds they know if I use a contaminated needle, I can get hepatitis C or HIV. But if you're withdrawing from drugs and you're desperate to use, you're just going to use the drug regardless of the long-term consequences. Is how our brains change during addiction. The immediate rewards become much more important, and the long-term consequences sort of recede further into our brain, and it leads to the very bad and dangerous decision-making we see during addiction. So this is why people will use these contaminated pills, or pills that are likely to be contaminated, and what people will snort cocaine that very certainly could be contaminated, risk their lives because they are addicted. And this is why we need to funnel many, many more resources towards treatment of addiction, especially as the drug supply grows more and more dangerous. Now, what can we do about all this? At the end of the day, what I've always advocated for is decriminalizing drugs. I think that if we decriminalize drugs, like we saw with cannabis, the rates of drug use wouldn't go up, just the dangers would go down because people would have access to a safe and regulated supply. For example, the millions of people, probably tens of millions of people in this country who have chronic pain or who are addicted to opiates wouldn't need to buy contaminated fentanyl either to inject or snort, or these contaminated pills on the streets, if they had regular access to a legal supply, for example, run by government stores. If they had safe access, they've done this in Europe. If you provide safe access to opiates, it doesn't increase drug use, it just decreases the number of overdoses and deaths. We could decrease cost, suffering, misery, and death, all by providing people with a safe and decriminalized source of these drugs. The other things we could do is we could pass out fentanyl test strips. We pass these out all the time in my clinic. People can test their drugs and then either not use their drugs or use less of them if they're contaminated with fentanyl. If you don't know there's fentanyl, you don't stand a chance. These fentanyl test strips are sort of gaining in popularity. They're being used at festivals and at raves where a lot of young people use drugs. We don't necessarily want young people using drugs, but if they're using them, we don't want them overdosing on fentanyl. So we could make the whole enterprise safer by testing these drugs and by passing out these test strips. We also can have more and more people carry that nasal spray that use Narcan that can immediately reverse a fentanyl overdose. I carry Narcan in my bag. I don't want to see someone unconscious and not give it a try, because a lot of times if you see someone unconscious, you can save their life with a simple squirt of this medication, Narcan. So there are a lot of things we could do to reverse this. Unfortunately, at the exact moment with the current political climate, we seem to be heading in the wrong direction. But I'm a big advocate of treating drug users and people who are addicted with empathy and compassion, and for doing everything we can to make things safer for the millions of Americans in this country that use illegal drugs. As a final note, a recent poll showed that 29% of Americans either have been addicted to or are related to someone who is addicted to opiates. That's 1 in 3 people. So we need to make the drug supply safer, and we need to keep people alive so that they have a chance to get into treatment and to regain their lives. Thank you so much for listening to my YouTube video. If you found this content helpful, please subscribe to my Substack newsletter. The link for my Substack newsletter, which has a lot of great similar content, is in the description of this video. Thank you very much.